Initiating it.
Oh,
Oh, we're live. We'll be live in 1 minute. Okay.
I think we're live right now, actually.
I think we're live now. Yeah.
Oh, that was from 2 minutes ago.
And we're live.
Should we go ahead and get started, or should we wait
Yeah.
for some folks to join?
Maybe we just start. I don't know.
Maybe
if
just start. Yeah.
All right. This is very organic. I love it. Well, I'm so happy that we get to spend some time together, and this is like the highlight of my week, and definitely like a fun way to end it with an awesome group of technical leaders and all around brilliant folks. So thank you all for joining today, and I did the wrong thing and didn't turn off my notifications, and now I did. So again, thanks for joining everybody. A few housekeeping items before we begin. We're going to talk for about 30 minutes today. Feel free to submit a question or comment at any time using the comment feature on your screen. And if you want a particular panelist to answer your question, please make sure that you call that person out. And we'll actually hold questions until the end today, just to make sure that we get through all of the conversation. And then we're also going to be recording the conversation today, and it'll be available afterward at providence-dig.org if folks want to find it at another time. So I'm so happy that everyone has joined today, and we're talking about a really interesting and meaningful topic. Historically, engineering has been a male-dominated field. Over the past few years, though, the women in engineering workforce has been growing, and we're not just paying lip service to DE&I or whatever, and we're not just simply creating equity in the profession, but we really believe that it actually has a direct impact on the technology and the innovation that occurs. And it's really incredible to see, whether it's giving us a broader sense and understanding of the social determinants of health, to bringing a greater sense of empathy into the product development. We have a physician on the line with us. Toyin will talk about how important it is to bring that perspective into development, and things like service design to help reduce bias, and all of that. A diverse engineering team with different perspectives is super important, right? Like, you can't do it unless you really understand it at a visceral level. So we, as Providence too, I serve as the chief strategy officer and the chief digital officer at Providence, and I've been here for 8.5 years and have seen how important our role in our communities is, and we serve so many different patient populations across a really big set of geographies across 7 states. Couldn't be more different from one another. Alaska through Texas and New Mexico and Washington, Oregon, California, and Montana. So we offer a lot of different perspectives, and we want to be representative of our communities. So I'm really excited to be joined by 3 awesome female engineering and technical leaders here at Providence to share their perspectives and points of view about why our approach to creating a diverse workforce in engineering is critical to the future of healthcare. And before we jump into that, I'll ask each of you to introduce yourselves and share what brought you into healthcare, or what, Toyin, in your case, what caused you to go to medical school and become a dermatologist and then leave and go do all these other amazing things that you've done. And I will call on each of you just to make it easy and we don't have to stare at each other awkwardly. So Toyin, let's start with you.
Well, so first off, I'm just so excited to be here, and not just because I just met someone from Alaska for the first time on this call. So very excited. Like she said, we really represent a very broad spectrum in the United States. So I'm a board certified dermatologist by training. I still see patients with the Stanford residents. I live here in the Bay Area. I've just always loved solving complex problems and helping people. And so medicine was just a really natural fit for just my personality and my interests. after really seeing patients and seeing how hard it is to be a patient, also how difficult it is to be a clinician, just with how complex our system is, I really got excited about ways in which that I personally could feel like I could impact clinicians and patients' lives. And being in the Bay Area, I was just always surrounded by tech innovation. And so got really excited about, could technology tools be a lens by which to look at how we could potentially improve healthcare for our patients and our clinicians? And that led me on a path of jumping from full-time clinical medicine into the startup world, and then most recently joining Providence last year. And I just have to say that working at Providence has been like the true highlight of my career, just being surrounded by so many people who are really excited about the same things I am, which is really using technology to make an impact, especially as someone who still sees patients and a clinician. It's very meaningful for me to be surrounded by other people who have the same passion and are bringing their perspectives to a problem that we're all trying to solve together. And so that has been really such an amazing experience, getting to be a clinician and not only working with other clinicians, but also working with technologists and using our shared expertise to solve these problems. So I have loved it so far. When they asked me to be on this LinkedIn Live, I was like, sign me up. I want to talk about Providence all day to everyone who will listen. So really excited about this and just glad to be here.
Awesome. Thank you, Toyin. We're happy that you're part of our team as well. Lisa, over to you.
Yeah, I'm Lisa Mason. I'm AVP of Product Design, User Research, and Product Analytics. And my path to Providence was kind of interesting. I'd been working in tech for a long time, and I'd worked on some really cool projects from Word to Xbox. I even did a small stint at HBO, and I loved my career, but I was struggling to find meaning behind what I was doing. So I resigned my job without a plan and told my team, give me a year. I'll be in politics or I'll be in healthcare. And about 6 months into that 1 year time limit I gave, I got a call from a woman working in DIG asking if I would come work for her. And I'm like, how could I say no? One, I'd never worked for a woman before, so I was excited to try that. Tech innovation, and then giving back to the community by really addressing some of the biggest issues that we've had in society, access to healthcare. So I've been at Providence now for almost 6 years, and I would say it's one of the best career choices that I've made.
Definitely a much better move than getting into politics. So good
Yeah.
job. Awesome, Lisa. Thank you. And Suneva.
Hey, I'm Sunita Runyon. I'm an engineering manager at Providence. I've been there for about 2.5 years. I have a traditional CS education, and I moved from the East Coast up to a really small town in Northwest Alaska about the same time I joined Providence. And with that move, I was looking for a new job because I didn't want to keep working East Coast hours. Um, and I lived in a community where like technology didn't really mean much. Like I'd introduce myself, I say I work in software, and that was kind of the end of the conversation. And so I really wanted to be more involved in a field that impacted more people. And so when I found Providence, I thought it was a really great fit because I can tell people I work in healthcare and there's follow-up questions. It's not like the conversation just dies. Healthcare is something that means something to everybody. So I thought it was a really great fit for me and a way a little bit to give back in my career as well.
And it's amazing that you also live in Alaska. Alaska is a really unique place in the country. And it's also, it's a very special place from a Providence perspective, too. We're often one of the only providers of healthcare in Alaska. So it's, just your closeness to that community is really cool. And we're also very happy you're part of our team. So, one thing I wanted to talk about with you all, healthcare is not known for being a really fast moving or rapidly changing industry. And for technologists, that it can be kind of like demotivating to think of, oh, I'm going to go and enter into this really change averse, slow moving, highly regulated industry. But I'd love to hear from each of you. Like, have you found those stereotypes to be true, that we're slow and hard to change, or do you think that it's actually an exciting opportunity, or maybe it's both? Maybe it's slow and averse to change and an exciting opportunity. But how do you view that? Suneva, let's go to you first.
Yeah, I think it is both. So there are some limitations with APIs. For instance, if you're trying to get somebody's health record, the data isn't necessarily always reliable. The system's really complex. But I think there is so much need for innovation in healthcare. And if we take the right tools, like we use Flutter, we use LLMs for some of our applications, you can actually like have innovative products, use new technology, and defy the slow stereotype of healthcare.
I agree, and I think like it's sort of like there are some constraints, but you can be creative within those
Right.
constraints.
Yeah.
Lisa,
And
Lisa, what do you think? Oh, sorry, go ahead, Sunila.
I was just going to say constraints actually can lead to more creative solutions too. So I think it's a great space to be creative in.
Absolutely.
Yeah,
Totally agree with that.
I agree. And I would agree that, the slowness does hold some truth. But I kind of divide it into the macro and the micro level. So at a macro level, if I'm thinking about the government, absolutely, they're slow. We know that applying for Medicaid and Medicare is super difficult. In fact, there's a cottage industry associated with helping people through that application process. But that's an opportunity for us. So could we innovate in that space? Can we help people? Or there's even adjacent solutions like helping people get access to financial assistance. Now, on a micro level, like in our health system, I observe our caregivers or our employees, if you will, they'll notice a problem and they'll pilot a solution. And that solution may be a process solution, or it may be, a cobbled together technology solution. And so there is a willingness to experiment and try things out. And I think as a result of that, like our health system was one of the first, if not the first, to release a COVID chatbot.
Yep.
And now we've expanded it to other use cases, and we do get to geek out on a daily basis on AI and Chat GPT, and Suneva will tell you all about that. But I look at it more as an opportunity.
That's the chatbot example is a really good one, and it's like, and I really love how you described like the micro and the macro. It's sort of like, you may chip away at little things. It's sort of like the same concept that people overestimate the impact of something in the short term and underestimate it in the long term. I mean, it really adds up over the long run, and you can do some pretty amazing things.
Yeah.
Toya, what do you think? And both speak from your perspective as a technologist as well as a clinician.
Yeah, so I think two perspectives. One, I came from the startup world, right? And I was working at pretty big venture-backed digital health companies. And I would say that was my biggest concern coming to Providence, right? I'm just used to shipping products. I'm a product person and having people use them pretty immediately. And I would say that I was really pleasantly surprised that internally that we are building tools that clinicians and patients are utilizing in their daily workflow or being affected by at, I would say, similar to pace to what I experienced in the startup world. One thing that I do think that Providence does really well is that some of the slowness is good, right? We have to remind ourselves that the end user is a patient, right? Or the end user is a clinician that's delivering care to a patient. So there has to be a lot more thought and nuance involved because these things have a potential risk to be so impactful, right? Which is why we're all doing it, why we're all passionate about the work. We really want to impact people's lives. But because of that, there has to be that sort of nuance and thoughtful deliberation to the way that products are developed. And so one thing I think that we do well here at Providence is that we really partner clinicians with technologists to really at the outset, to really ideate these products all the way through the implementation to ensure not only are they innovative, but that the end user, again, patients and clinicians' lives are actually improved and impacted in a beneficial way. So that partnership, something I think is really unique at Providence and something that keeps me working here.
And it's really hard to truly appreciate like the nature of both the problem and a solution unless you've got those perspectives coming together and like that really, really, really deep like exposure, and you can peel away at the problem in a way that like it's really hard to do if you're from the outside, or if you're only viewing it from only a clinical lens or only a
Exactly.
technology lens. You really got to bring them together in like a multidisciplinary way. I think I totally agree with you. That's very special. Um, Suniva and Lisa, you both referenced like large language models and GPT. What are each of you working on that like somebody might be surprised that we're actually doing that kind of work in a health system? And actually, Toyan, I'm going to start with you on this one, just because I know you're working on a very cool project that folks will be interested in hearing about.
I love bragging about this project because it just talks a lot about that like tight marriage that we have with clinicians and technologists. There's a tool internally incubated at Providence called MedPearl, and it's a clinician founder. And she was just, you would just love her if you met her, but she's just the most dedicated person to making clinicians' lives better. And she just had an idea and developed it herself. She like made her own little chatbot, which I think is wonderful, and then got partnered with a technologist, a strong CTO. And through a series of user-centered design, because we have clinicians here at Providence who are also excited about technology, they were able to develop a clinical decision support tool and content knowledge management system that enables clinicians to be empowered with information at the point of care when they're seeing patients, and provided with the next best action for what to do when they have a patient in front of them. And the coolest part about it is that because they work together with clinicians and technologists, they created a no-code sort of interface so the clinicians can actually help develop this content without needing to code themselves. And that sort of partnership between an engineer and a clinician, identifying a problem, coming up with a product that's now used across Providence. We have thousands of clinicians using this every day. To me, is like the magic that I think could only happen at an environment that supports that kind of close collaboration, and then actually ships products that people are able to use. And the outcomes have been really successful. Clinicians are using it at the point of care, and ultimately patients are the ones whose lives are being improved by clinicians having this sort of actionable knowledge at the point of care. So I could brag about MedPro all the time. I just think it's like a case study in what Providence does well.
It is, and shameless plug, if folks want to learn more about it, you can go to medpearl.com and learn more, right?
Yeah. I didn't even pay her to say that. That was for free. That was a free plug.
Awesome. Lisa, how about you? I know you've been working on all sorts of super interesting things. Why don't you tell us about a couple of them?
So I'm working right now on a project to build internal tools for our employees. And the goal of this tool is to help people be better and more efficient at their jobs so that they can do the core, which is to provide care to our patients. And we have at Providence an amazing group of individuals that are called community health workers. And what they do is they spend a few days a week at a public library or at the Salvation Army helping the community. And I went and shadowed these folks, and we had a person come in that was hard of hearing and didn't speak English very well. And so we helped them get a bank account open. Or I spent another person we spent an hour and a half with applying for housing assistance. Now, they weren't Providence patients. These weren't health related things. This is something that Providence does to help the community. But these people had issues and conditions where they live, work, and play that impacted their quality of life, which then in turns impacts their health. So we spend a lot of time in the community, and I got to spend time with these individuals, helping them figure out how to be more impactful in their day-to-day roles. And it actually made me really proud to be part of this organization that we do things like this.
And, for folks who may be listening who don't know, to what Lisa mentioned, your health is only about 12% or so. Your health and your health outcomes are only about 12% impacted by your health care delivery. Everything else, your housing, your food, whether you're safe in your neighborhood, all of those things are actually the rest of that, it's the 88%. And at Providence, we take a really proactive approach, not just to the delivery, but also to the other enablers and determinants of health. And we get exposure to those problems in our communities and are able to address them with technology and other solutions that are really meaningful. And to Lisa's point, like on the ground, real issues, not like solutions looking for a problem, but real problems that people are facing today. So I love that. That's a great example, Lisa. Suniva, how about you?
Yeah, the project I like talking about the most is it tackles the provider inbox burden. Usually when I talk about this project, I ask people if like raise your hand if you've ever sent a message to your healthcare provider, and people raise their hands, especially after COVID. Everybody started relying on these async communications to reach out to the provider, which is great, but it also means that providers' inboxes are inundated with these messages. Uh, and people send a lot of things that don't necessarily need the provider to take time to answer. They might ask questions like, um, can I schedule my next appointment? Like you don't necessarily need the doctor to go in and tell you, oh, you can schedule an appointment by doing XYZ. You should be able to self-serve in cases like that. And so enter LLMs, which is really in this project, we take people's messages, we use LLMs to understand them, and then we try to see if the person can self-serve instead of sending a message to their provider. And it's really cool to see the impact this has had. We block somewhere between like this is recorded, so I'm not going to say a specific number, but it's something like 20 to 30% of non-value add messages. And in those cases, we're actually letting these people self-serve. They're getting answers to their questions faster, and then the providers aren't having to spend like their lunch break or their weekends responding to these messages that are collecting in their inbox. And so that's probably my favorite project to talk about.
It's a really exciting body of work, and just being able to, like, we call it intent recognition, right? Like understand, like we have a comprehension layer that Suniva and the team have built that understands the intent of the patient and then guides them through an experience so that they can get their needs fulfilled. And in a way that's not like painful and feels like you're just shifting work from one place to another, right? So it's an amazing innovation that's really built on what Lisa articulated at the beginning, which was our chatbot, right? That's the client interface, and it lives in multiple places on our digital presence, and we call her Grace, and she has a role to play as a partner for our patients, and she's getting smarter every day. So it's a pretty cool, I love that as like an example of a really, really wonderful innovation that's not just like a dumb chatbot that, is excruciating to deal with. One of the things I mentioned at the beginning, there are lots of generalizations about technologists, and it's a largely white male-dominated field, and yet here we are sitting with 3 technologists who are women, operating in one of the largest health systems in the country, and working with an organization with lots of other female leaders as well. And Lisa, maybe I'll just direct this to you because you came from big tech, and you spent a lot of years doing big tech work in different industries as well. What does being a woman in this field, like at the intersection of healthcare and technology, mean for you as an individual? What has been your experience so far?
It's really, I view it as an opportunity to challenge and address stereotypes, and how it really helps us to have a diversity in our staff so that we can build better software. You may have heard the phrase shrink it and pink it, which is you take a design, something that's designed for a guy, you make it smaller, and then you make it pink. And then that's designing for women. But if you look at the research, research on women in the military, they're more likely to have hip issues and broken bones because the shoes don't fit and their backpacks don't fit. And so that approach to product design just does not work. And it's really sad when over half the population is women and we make purchase decisions. So I bring that perspective to how we develop software. Many times, somebody will come to me with our mobile app, for example, and say, will you remove the content about menstrual cycles and menopause from the app when we know that the user is a male? I'm like, no, I don't think that's the right approach to take, because their fathers, their husbands, their spouses, their brothers, they have relationship with women, and this really information that they need to know so that they can be informed. So basically what I'm trying to do is be all inclusive and create an environment where the next generation of women can feel comfortable and not face as many of the challenges that I've faced throughout my career as a woman in the organization.
That's awesome. Suniva or Toyin, anything that you would add to that? Any different experiences or the same that you would add more to?
Well, one thing I would comment on is just, the work that we're doing, again, there is a patient and a clinician being affected. And for us, diversity and inclusive thinking about product design is table stakes, right? We're across 7 states. We saw almost 30 million patient visits last year. We're a large organization that spans urban and rural areas. And so our patient population, our clinicians mirror our diverse and inclusive population in the United States, right? And so it's not just something that we can talk about and think is a fun thing. We have to have inclusive products, and we have to have diverse stakeholders making them, because we want to make the best products for the patients and the clinicians that we ultimately serve, because we want the products to help them in their day-to-day lives. So I don't think it's just something that we talk about. I think it's something that's bred in our culture here. This is actually the most women I've ever worked with in my career. And I just think it's something that isn't even had to be said, because it's a natural part of our product development process, because we know who we're serving at Providence. And for me, I think that actually makes it an actually fun place to work, is that we're making products that's basically for a microcosm of the United States population.
It's awesome.
Yeah,
oh, go ahead, Suniva.
I was just going to echo everything. I love Lisa's example of the menopause content, for instance, being asked to take that down. I think we need more people like Lisa in this industry who are advocating for things like that in Toyin as well. And so I'm just really happy that I'm getting to work with people who are bringing up perspectives to healthcare and technology in healthcare.
This is we could keep going for a long time, but I want to just kind of close us out with a couple more questions. Toyin, what you just said around bringing female and diverse perspectives to product development is really intentionally saying look, we represent a whole bunch of different people. We represent half the population as females. We represent all sorts of different states, all sorts of different ethnicities and races, and that's all critical. And it's a very it's a very human and practical approach, and there's power in that practicality, because you're actually just intentionally saying I understand who I'm serving, and I'm going to go and serve those folks with product design in a really thoughtful way. I love that. Maybe I'll just kind of wrap up and ask you each for one final thought. You've all done a variety of interesting things. If you were talking to a peer at a non-healthcare organization, what would be your pitch to them, in a minute or less, for why they should work in healthcare and why they should consider healthcare as a really awesome place for innovation? Toyin, let's start with you.
For me personally, I just don't think there's any bigger challenge to solve than healthcare, right? Every single person has been impacted by healthcare, either seeing a physician or clinician, or undergoing a health problem, or being a caregiver to someone who has. And it's a complex, difficult system. And we know that clinicians and patients are dissatisfied the way it's working now. And we need people who are disruptive, innovative, excited to tackle what I think is the biggest, most impactful problem, because it affects literally every single person on the planet. And there's no better place to do it than at Providence. So I welcome you to join us, trailblazers, in trying to solve one of the biggest existential problems that face all of us.
Yes, please. Suniva, how about you?
I think there's so much opportunity for innovation in the healthcare space. And if we have the right people tackling problems, then we have the potential to positively impact, like Doyen said, everybody in the world, everybody who's watching this live, everybody who's going to watch the recording. And that to me is just really inspirational. And if you're a person who is also inspired by the potential of that impact, then healthcare is a fantastic place to be.
Lisa, I will give you the final word.
Okay. A while back, I received a piece of user feedback in the App Store and try to get it close, but the feedback was, I'm unable to vocalize right now due to cancer. This app is perfect with the message area. It takes the frustration out of trying to make appointments when people hang up on me because they can't understand me or I can't speak loud enough to be heard. I can refill my meds, make appointments, get test results, and talk with whomever I need. So that sums it up for me. I mean, by designing an application that is accessible and accounts for the wide variety of needs that we have, I can't think of anything more rewarding.
That's amazing. I hadn't heard that review before, so thank you for sharing that, Lisa. That's amazing. And it's a really appreciate everybody joining us. Come join us even more. And it's a target-rich environment with all sorts of fun problems to solve with really smart, amazing people. So thank you again, and hope to see you all with us soon, joining us in our cause.
Thank you.
Thanks.